Coming through. Stand back, please. Scene is safe.
The first step of BLS is assessment and scene safety. The first rescuer who arrives at the side of the victim must quickly be sure that the scene is safe. The rescuer should then assess the victim for a response and breathing.
Hey, are you okay? Can you hear me? He isn't responding. Isn't breathing normally, just gasping. Grab the AED.
If the rescuer is alone, he or she would then call for help and get the AED. The next step is to check for a pulse. To perform a pulse check in the adult, feel for a carotid pulse.
No pulse.
This technique is usually easier to perform on the side near the rescuer. Locate the trachea using 2 or 3 fingers. Slide these fingers into the groove between the trachea and the muscles at the side of the neck, where you can feel the carotid pulse. Perform the pulse check for at least 5 seconds and no more than 10 seconds.
2, 3.
If you do not definitely feel a pulse, immediately begin CPR, starting with chest compressions, CAB sequence. CPR improves a victim's chances of survival. There are several critical elements of high-quality CPR you should remember. Start compressions within 10 seconds of recognition of cardiac arrest. Push hard, push fast. Provide compressions at a rate of at least 100 compressions per minute and at a depth of at least 2 inches or 5 centimeters for adults. Allow complete chest recoil after each compression. Minimize interruptions. Try to limit interruptions in compressions to less than 10 seconds. Give effective breaths that make the chest rise. Early CPR keeps the oxygen and blood flowing to the heart and brain, creating valuable life-saving time until spontaneous circulation is restored. Of the One Rescuer BLS skills together.
Hey, are you okay? Activate the emergency response, grab the AED. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17.
Although AEDs may differ slightly, there are 4 universal steps for operating an AED. First, turn on the AED. Open the carrying case or the top of the AED, then turn the power on. Some devices will power on automatically when you open the lid. The AED will guide you, but it's still critically important that you know these steps. Some AEDs may have adult and pediatric pads. Make sure you use the adult pads on anyone 8 years of age and older. Peel away the backing from the pads. Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad to the side of the left nipple. Place the other pad on the victim's upper right chest, directly below the collarbone. If instructed by the AED, clear the victim and analyze the rhythm.
11, 12.
Analyzing heart rhythm. Do not touch the patient.
Let's switch.
Shock needed. Charging. Stay clear of patient. Press the flashing
Shock advised.
button
Clear.
now.
Be sure that no one is touching the victim, not even the person in charge of giving breaths. Ideally, you will pause CPR during or immediately after a set of compressions. Some AEDs will tell you to push a button to allow the AED to analyze the heart rhythm. Others will do that automatically. The AED may take about 5 to 15 seconds to analyze the rhythm. The AED then tells you if a shock is needed. If the AED recommends a shock, it will tell you to clear the victim and push the shock button. Again, be sure no one is touching the victim to avoid injury to rescuers. Then loudly state a clear the victim message. It can be something like, "Everybody's clear," or simply, "Clear." Perform a visual check to ensure that no one is in contact with the victim.
Shock advised. Clear.
Press the shock button. The shock may produce a sudden contraction of the victim's muscles. As soon as the AED gives the shock, Immediately resume CPR, beginning with chest compressions. Do not remove the AED or turn it off. The AED will repeat the analyze and shock cycle every 2 minutes.
No shock needed.
When the AED indicates no shock advised, you do not check the pulse first, you immediately start chest compressions again. There are also some special situations you'll need to consider when using an AED. If a victim has hair on his chest, the hair may prevent the pads from sticking. The AED may tell you to check the pads. If this happens, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. If your AED supply kit has a razor, you can use this to shave the area as well and then reapply a new set of pads. Water on the victim's chest could allow the shock to travel through the water between the pads and prevent delivery of an effective shock dose to the victim's heart. If someone is lying in water, you should quickly move the victim to a dry area. If the victim is lying on snow or in a small puddle, you may use the AED. If the chest is covered with water or sweat, wipe the chest before attaching the AED pads, but wipe the chest quickly as it doesn't have to be completely dry. Some people have implanted pacemakers and/or defibrillators in the same place where you would put the AED pads. The device will look like a round or square lump, smaller than a deck of cards. If you see this lump, try to avoid putting the pad directly over the lump. Do not place the pad directly over a medicine patch. If the shock delivery will not be delayed, take the patch off and quickly wipe the chest